Welcome to my YouTube channel. In this video we will talk about cancer. Before going to the video, make sure you hit the like share and subscribe button so you don't miss any update from US. What is cancer? Cancer is a large group of diseases with one thing in common. They all happen when normal cells become cancerous cells that multiply and spread. Cancer is the second most common cause of death in the US, but fewer people are dying of cancer now than 20 years ago. Early detection and innovative treatments are curing cancer and helping people with cancer live longer. At the same time, medical researchers are identifying independent risk factors linked to developing cancer to help prevent people from developing cancer. What is the difference between a normal cell and a cancerous cell? Normally, cells follow instructions provided by genes. Genes set down rules for cells to follow, such as when to start and stop growing. Cancerous cells ignore the rules that normal cells follow. 1. Normal cells divide and multiply in a controlled manner. 1. Cancerous cells multiply uncontrollably. 2. Normal cells are programmed to die, apoptosis. 2. Cancerous cells ignore those directions. 3. Normal cells for solid organs stay put. 3. All cancerous cells are able to move around. 4. Normal cells don't grow as fast as cancerous cells. How does cancer start in your body? Cancer starts when a gene or several genes mutate and create cancerous cells. These cells create cancer clusters, or tumors. Cancerous cells may break away from tumors, using your lymphatic system or bloodstream to travel to other areas of your body. Healthcare providers call this metastasis. For example, a tumor in your breast may spread to your lungs, making it hard for you to breathe. In some types of blood cancer, abnormal cells in your bone marrow make abnormal blood cells that multiply uncontrollably. Eventually, the abnormal cells crowd out normal blood cells. How common is cancer? According to the American Cancer Society, 1 in 2 men and people assigned male at birth, AMAB, and 1 in 3 women and people assigned female at birth, AFAB, will develop cancer. As of 2019, more than 16.9 million people in the US were living with cancer. The most common cancers in the United States are 1. Breast cancer. Breast cancer is the most common type of cancer. 1. It mostly affects women and people AFAB. 1. But about 1% of all breast cancer cases affect men and people AMAB. 2. Lung cancer. Lung cancer is the second most common cancer. 2. There are 2 types of lung cancer, non-small cell cancer and small cell lung cancer. 3. Prostate cancer. This cancer affects 1 in 9 men and people AMAB. 4. Colorectal cancer. Colon cancer and rectal cancer affect different parts of your digestive system. 5. Blood cancers. Leukemia and lymphoma are the most common blood cancers. Who's affected by cancer? Almost anyone may develop cancer, but data show cancer cases vary based on race and sex. According to the 2022 Annual Report on Cancer, the disease 1. Affects slightly more men and people AMAB than women and people AFAB. 2. Affects more black men, AMAB, than people in other racial groups. 3. Affects more women, AFAB, who are American Indian or Alaska Natives than people in other racial groups. Almost anyone may develop cancer, but it typically affects people aged 60 and older. Symptoms and causes. What are cancer symptoms? Cancer is a complicated disease. You can have cancer for years without developing symptoms. Other times, cancer may cause noticeable symptoms that get worse very quickly. Many cancer symptoms resemble other, less serious illnesses. Having certain symptoms doesn't mean you have cancer. In general, you should talk to a healthcare provider anytime there's a change in your body that lasts for more than 2 weeks. First symptoms of cancer. Some common early cancer symptoms include 1. Unexplained weight loss. 2. Chronic tiredness. 3. Persistent pain. 4. Fever that occurs mostly at night. 5. Skin changes, particularly moles that change shape and size or new moles. Left untreated, cancer may cause additional symptoms, including 1. bruising or bleeding more easily. 2. Lumps or bumps under your skin that don't go away. 3. Difficulty breathing. 4. Difficulty swallowing. What causes cancer? Cancer is a genetic disorder. It happens when genes that manage cell activity mutate and create abnormal cells that divide and multiply, eventually disrupting how your body works. Medical researchers estimate 5% to 12% of all cancers are caused by inherited genetic mutations that you can't control. More frequently, cancer happens as an acquired genetic mutation. Acquired genetic mutations happen over the course of your life. Medical researchers have identified several risk factors that increase your chance of developing cancer. Cancer risk factors you can control. 1. Smoking. Smoking cigarettes and cigars and using e-cigarettes increases your chance of developing lung, pancreatic, esophageal and oral cancer. 2. Diet. Eating high-fat or high-sugar foods can increase your risk for many types of cancer. 2. You're also more vulnerable to disease if you don't get enough exercise. 3. Environment. Exposure to toxins in your environment, such as asbestos, pesticides and radon, can eventually lead to cancer. 4. Radiation exposure. Ultraviolet, UV, radiation from the sun significantly increases your risk of developing skin cancer. 4. Overexposure to radiation treatment can also be a risk factor. 5. Hormone therapy. Women and people AFAB taking hormone replacement therapy may have an increased risk for breast cancer and endometrial cancer. Genetic testing. Cancer may happen when a single gene mutates or several genes that work together mutate. Researchers have identified more than 400 genes associated with cancer development. People who inherit these genes from their biological parents may have an increased risk of developing cancer. Healthcare providers may recommend genetic testing for cancer if you have an inherited form of cancer. They may also do genetic testing to do therapy that targets specific cancer genes. They use test results to develop a diagnosis. They'll assign a number or stage to your diagnosis. The higher the number, the more cancer has spread. How is cancer stage determined? Healthcare providers use cancer staging systems to plan treatment and develop a prognosis or expected outcome. TNM is the most widely used cancer staging system. T stands for primary tumor. N stands for lymph nodes and indicates whether a tumor has spread to your lymph nodes. M stands for metastasis, when cancer spreads. What are the 4 stages of cancer? Most cancers have 4 stages. The specific stage is determined by a few different factors, including the tumor's size and location. 1. Stage 1. The cancer is localized to a small area and hasn't spread to lymph nodes or other tissues. 2. Stage 2. The cancer has grown, but it hasn't spread. 3. Stage 3. The cancer has grown larger and has possibly spread to lymph nodes or other tissues. 4. Stage 4. The cancer has spread to other organs or areas of your body. 4. This stage is also referred to as metastatic or advanced cancer. Though stages 1 through 4 are the most common, there's also a stage 0. This earliest phase describes cancer that's still localized to the area in which it started. Cancers that are still in stage 0 are usually easily treatable and are considered precancerous by most healthcare providers. Management and treatment. How do healthcare providers treat cancer? Healthcare providers may use several different treatments, sometimes combining treatments based on your situation. Common cancer treatments include 1. Chemotherapy. Chemotherapy is one of the most common cancer treatments. 1. It uses powerful drugs to destroy cancer cells. 1. You may receive chemotherapy in pill form or intravenously, through a needle into a vein. 1. In some cases, providers may be able to direct chemotherapy to the specific area affected. 2. Radiation therapy. This treatment kills cancer cells with high dosages of radiation. 2. Your healthcare provider may combine radiation therapy and chemotherapy. 3. Surgery. Cancerous tumors that haven't spread may be removed with surgery. 3. Your healthcare provider may recommend therapy. 3. This treatment combines surgery with chemotherapy or radiation to shrink a tumor before surgery or to kill cancer cells that may remain after surgery. 4. Hormone therapy. Sometimes, providers prescribe hormones that block other cancer-causing hormones. 4. For example, men and people assigned male at birth who have prostate cancer might receive hormones to keep testosterone, which contributes to prostate cancer, lower than usual. 5. Biological response modifier therapy. This treatment stimulates your immune system and helps it perform more effectively. 5. It does this by changing your body's natural processes. 6. Immunotherapy for cancer. Immunotherapy is a cancer treatment that engages your immune system to fight the disease. 6. The treatment may be called biological therapy. 7. Targeted therapy for cancer. Targeted therapy is a cancer treatment that targets the genetic changes or mutations that turn healthy cells into cancer cells. 8. Bone marrow transplant, also called stem cell transplantation. This treatment replaces damaged stem cells with healthy ones. 8. Autologous transplantation uses your supply of healthy stem cells. 8. Allogeneic transplantation uses stem cells donated by another person. Thanks for watching the video. Make sure you hit the like share and subscribe button so you don't miss any update from US.